Hello, colleagues. It's good to meet you. I'm Marcia Bradley, and today I want to talk about the human sense of hearing. Excuse me? We all tell and hear the jokes. Yet the fact is that about 48 million Americans suffer from hearing loss. According to the National Institute on Deafness and Communication Disorders, about one-third of people ages 65 to 74 report hearing difficulties. And the number rises to about half by the age 75. Untreated hearing loss is a notable national health problem, potentially linked with depression, a reduction in memory and concentration, and dementia. A decrease in hearing can influence attitude and be socially impacting. So, what causes hearing loss? Sensorineural, the most prevalent type of hearing loss, originates from damage to the tiny hair cells that line the inner ear. Incoming sound waves are converted into electrical signals that are transmitted to the brain. The brain interprets the signals as significant sounds. Sensorineural damage is permanent but can be managed with the help of hearing aids. Hearing aids amplify sound and reduce filtering out background noise. Although aging and chronic exposure to loud noises causes most hearing loss, there is an increased risk of damage due to some medications, illnesses, and a family history of deafness. Conductive hearing loss is less common and results from a middle or outer ear physiological disorder, obstruction, or malformation. Some conductive hearing loss may occur when earwax becomes impacted or middle ear infection leads to fluid buildup. Removal of the wax buildup in the outer ear and treating infectious diseases in the middle ear can restore hearing. Malformations of the inner and middle ear may be corrected surgically. Many adults have a combination of both types of hearing loss. For example, age-related hearing loss plus wax in the middle ear can interfere with sound conduction to the inner ear. Fortunately, there are leaps of faith, dedication, and commitment in the audiology field. A recent breakthrough for hearing impaired individuals of all ages is cochlear implant surgery. The cochlear implant is particularly suitable for people with significant hearing loss who have difficulties communicating, even with the help of hearing aids. Unlike conventional hearing aids, which amplify sound, a cochlear implant is a prosthetic, which it's a device that is a design that circumvents the damaged areas of the inner ear. Electric pulses stimulate the auditory nerves directly, and the pulses travel onto the brain, which interprets them as sound. Thorough audiology evaluation determines candidacy for cochlear implant surgery. Before surgery, the Centers for Disease Control suggests anti-pneumococcal vaccinations to protect against potential infections, such as meningitis. The attending audiology team will explain the timing and the types of advised vaccines to obtain from primary care physicians. During a relatively short outpatient operation under general anesthesia, only the internal component of the cochlear implant is performed. The length of time for the procedure is usually 2 to 3 hours. Patients often go home the same day, and recovery time is 1 to 2 weeks. After surgery, a mandatory 2 to 4 week healing period is required before the prosthetic can be activated. After a final post-operative checkup, the cochlear implant recipient receives the external component and the implant is turned on. Here I have a picture, and this shows the electroalloy that is the internal implant, and this is the external implant that goes above the ear with the transmitter, the speech processor, the receiver, stimulator, and a tiny microphone. There is an adjustment period for the patient to learn how to hear with the use of the implant. It will take time to realize hearing progress. Regular visits with the audiologist at 3, 6, and 12 months after the implant is activated will allow necessary adjustments for optimal hearing. Follow-up also includes sessions with speech-language pathologists to fine-tune listening and communication skills. Oral rehabilitation is critical to attaining full hearing capability. Fortunately, almost every person who receives a cochlear implant realizes profound long-term improvements with few complications. The device is long-lasting and does not require more surgery to be updated. Board-certified neurotologists in the study and treatment of neurological ear disorders have been successfully performing cochlear implant surgery on adults in their 90s. Ongoing research and development is improving the quality of lives for millions of hearing impaired Americans. Thank you for listening to me. Does anyone have any questions?